You wake up with a fever, not the kind you shake off by lunch, the kind that makes your skin feel too tight. Your throat burns. Your legs won't hold you the way they should. There's no pharmacy down the street, no doctor's office, no phone to call one, even if there were. It's 40,000 years ago, and something inside your body has gone wrong. And the only thing standing between you and whatever comes next is a handful of people around a fire who have exactly the same tools you do, which is to say, none. So here's the question that should genuinely bother you. Humanity survived. Not just survived, thrived, spread across every continent, outlasted ice ages, outlasted extinction events that wiped out species with far better defenses than ours. How? Let's start with what you probably already believe, because it's what almost everyone believes, and it's wrong in a way that's about to surprise you. Most people picture ancient life as one long, brutal siege of sickness, plague after plague, fever after fever, a miserable, disease-ridden existence saved only by the eventual arrival of doctors, hospitals, and modern medicine thousands of years later. That picture feels obvious. It feels safe to believe. It's almost completely backward. To understand why, you need to sit with a strange fact about disease itself. A fact almost nobody thinks about until it's pointed out to them. Diseases need people, not just one person, not just a small group. Some of history's most devastating killers, the ones that show up in every list of humanity's greatest enemies, measles, smallpox, influenza, need something very specific to survive at all. They need crowds. Here's where it gets strange. Researchers who study exactly this have found that a disease like measles needs a continuous pool of hundreds of thousands of people packed closely together to keep itself alive indefinitely, not to infect a few, to simply exist as an ongoing threat. Now picture the actual size of an ancient human group. 20 people, 30, 50 if you were part of something unusually large. Do the math for a second, and something uncomfortable starts to surface. If a disease that needs hundreds of thousands of hosts somehow appeared inside a group of 30 people spread out across an open landscape, what happens to it? It runs out of people to infect, almost immediately. It has nowhere left to go. It dies. Which means the specific category of disaster you're picturing right now, the sweeping plague, the population-devouring epidemic, was, for most of human history, almost impossible. Not because ancient bodies were tougher than yours, because the disease itself couldn't find enough fuel to keep burning. So if the Great Plagues weren't the real threat, what was? This is where the mystery actually starts, because the honest answer isn't as clean as you'd expect. It's smaller, quieter, and in its own way, far more dangerous, because it was hiding in plain sight the entire time. Picture yourself again, 40,000 years ago. You've just survived something violent. Maybe an animal attack. Maybe a fall. There's a deep cut down your leg, and it's bleeding. And you already know, somewhere in the back of your mind, that the wound itself might not be the thing that kills you. It's what comes after. You have no idea what bacteria are. Nobody around you does either. There's no such word, no such concept. All anyone can see is that some wounds heal, and some don't. And some people who survive the original injury quietly die weeks later, for reasons nobody can explain. Now here's the part that should genuinely stop you. In 2022, archaeologists digging in a cave on the island of Borneo found the skeleton of a young person who lived roughly 31,000 years ago. Their lower leg was missing, not torn off, not lost in some accident. Removed, deliberately, cleanly. Somebody cut through that leg, on purpose, in a way that avoided the major blood vessels well enough that the patient didn't bleed to death on the spot. And the bone tells you something even stranger. It healed. The person lived for years afterward. Into their late teens, cared for the entire time by people who had no antibiotics, no sterile tools, and absolutely no scientific concept of infection. So ask yourself the obvious question. How? How do you perform successful surgery 31,000 years before anyone understands what a bacterium is? The answer starts somewhere you'd never expect to look, in the plants growing right outside the cave. Go back even further, to a burial site in a cave in Iraq called Shanidar, roughly 60,000 years old. When researchers examined the soil around one particular burial, they found something unexpected: pollen. Not scattered randomly, but clustered, concentrated, arranged around the body in a pattern that doesn't happen by accident. The flowers responsible for that pollen weren't decorative. One of them, yarrow, is still used today, across dozens of unconnected cultures, as a treatment for wounds. It carries real, measurable antimicrobial properties. Now here's the twist that should genuinely unsettle you. This wasn't a modern human burial. It was a Neanderthal. A species we've spent generations picturing as brutish, unthinking, barely capable of complex thought, may have understood something about plants and healing that took our own species tens of thousands of years to formally explain. And it goes back even further than that. Watch a chimpanzee closely enough, and you'll see something researchers have documented, filmed, and confirmed repeatedly. When a chimp gets sick with intestinal parasites, it doesn't eat its normal diet. It seeks out one specific plant. A plant with zero nutritional value, but a very specific, very real antiparasitic effect. It only eats this plant when it's sick, which means the instinct to treat illness deliberately, to reach for something specific in the environment because it makes you better, might be older than humanity itself, older than language, older than fire. So by the time modern humans were fully established as hunter-gatherers, this wasn't some crude, accidental habit anymore. It had become something close to a science, built entirely without science. Willow bark. Chew it, and something inside it, a compound called salicin, gets converted by your own body into the exact same active ingredient in aspirin. Ancient people in Egypt figured this out. So did people in Greece. So did people in China. So did people across the Americas. None of them had contact with each other. They all arrived at the same answer, independently, because pain is an extraordinary motivator, and willow trees happen to grow almost everywhere. Then there's honey. Ancient Egyptian medical texts describe it as a wound dressing 3,000 years ago. So do ancient texts from India. So do ancient Greek writings. And here's the part that should make the hair on your arm stand up a little. It actually works. Honey pulls water directly out of bacterial cells through simple physics, killing them. It also produces a slow trickle of hydrogen peroxide as a natural byproduct. Modern hospitals, today, in the 21st century, use medical-grade honey to treat certain wounds that resist normal treatment. Nobody applying it 3,000 years ago understood any of that chemistry. They just noticed. Wounds treated with honey healed. Wounds left alone, often, didn't. And that noticing, repeated across thousands of years, across countless individual tragedies and countless individual recoveries, quietly built something extraordinary. A working medical system, entirely without theory, entirely without explanation, built purely on watching what happened and remembering it. But here's where the story takes a turn you didn't see coming. Because if small, scattered, constantly moving groups were actually protected from the worst epidemics, if their wandering lifestyle accidentally shielded them from the very diseases that terrify us most, then something had to change. Something had to break that protection. And it did. Roughly 10,000 years ago, humans started doing something they had never done before at any real scale. They stopped moving. They built permanent homes. They began living, for the first time in the entire history of our species, in the same exact spot, year after year. And they brought animals with them, cattle, pigs, chickens, living close, sleeping close, breathing the same air day after day for the first time in human history. Here's the moment where the mystery flips completely upside down: measles, one of the most devastating diseases in human history. Researchers tracing its genetic origins have found it's closely related to a cattle disease called rinderpest. Influenza carries deep genetic ties to viruses that live inside domesticated birds and pigs. The diseases you're afraid of, the ones that fill history books with mass graves and burning cities, they weren't ancient. They weren't waiting in caves for humanity to stumble into them. We built them by settling down, by packing ourselves into permanent villages, by sleeping within arm's reach of the very animals whose viruses would eventually jump the gap into our own bodies, and by finally providing those viruses with exactly what they'd always needed and never had: enough people close enough together for long enough to keep the fire burning. So think about what that actually means. The image you've been carrying around your whole life, the primitive, disease-ravaged caveman, saved only by the later arrival of civilization, has the entire story backward. The wandering hunter-gatherer, with no medicine, no doctors, and no antibiotics, was, in a very real and very measurable sense, living inside one of the safest disease environments our species has ever experienced. It took building civilization to lose that safety. Now here's where this stops being a story about ancient history, and starts being a story about you. Because the instinct that let a Neanderthal lay flowers with real medicinal properties over a grave, the instinct that let a group of hunter-gatherers in Borneo successfully amputate a child's leg using nothing but stone and plants and careful attention, the instinct that noticed, over and over, across completely disconnected cultures, that honey helps and willow bark helps and certain plants help, wasn't luck. It was pure, patient, relentless observation. Generation after generation, watching what happened, remembering it, and passing it forward. No labs, no microscopes, no germ theory. Just humans, paying close enough attention to their own survival, for long enough, that the right answers eventually became impossible to miss. You survived that fever 40,000 years ago, not because someone understood why the willow bark worked, or why the honey stopped the infection, or why the flowers by the grave mattered. You survived because someone, at some point, paid attention, and then told someone else what they saw. That's it. That's the whole secret. No plague ever wiped out the species that figured that out first. It took building cities, and filling them with livestock and strangers, to finally invent the diseases capable of doing that. Which means the real question was never how did they survive without medicine, it's this. What did we lose, the moment we stopped needing to pay that much attention?